Severe and widespread floods across Yemen have brought more hardship to tens of thousands of displaced families. Nearly 30,000 families have been affected and at least 91 people killed, a figure expected to rise with many more injured or missing. This report gives more details.
With the rising climate disasters, heavy rains and floods worsened the struggle on Yemenis. Especially after almost 8 years of conflict, millions of people in Yemen need immediate humanitarian assistance. They have lost their homes, the economy has collapsed, and it is now the humanitarian organization's call. Last April, the sky was full of clouds. Then suddenly, heavy rains washed away Yemeni shelters and everything was destroyed. Flash floods have wasted critical infrastructure including roads, water sources, and healthcare centers. Of the over 300,000 people estimated to be affected by the emergency, over half of them are women and girls, many of whom have already been displaced multiple times and are in a vulnerable physical and psychological state. To reach those displaced by the flooding, UNICEF and World Food Programme are leading a humanitarian campaign in which teams are distributing kits containing women's clothing and essential hygiene items, such as soup and sanitary pads, along with jerry cans and ready-to-eat food. Each kit is designed to cover a family's basic necessities for 5 to 7 days and help alleviate their ordeal. Of the 4 million people displaced in Yemen, the majority are women and children. More than 1 million women are currently pregnant, and they are at risk of developing life-threatening complications with no access to health services. Moreover, severe funding shortfall means even essential programs have been scaled back, endangering the lives especially of displaced pregnant women, newborns, and the vulnerable. And after cutting the services, the care staff can't reach those in urgent need of support. The change in location and in their lives was shattering. Suddenly unemployed, isolated, and worried for their children's health, no longer having a safe roof over their heads, left the young parents with an impossible choice.